Hi guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In the previous video, we discussed about the Hypnotoin type of anticonvulsant drugs. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and the other topics of pharmaceutical sciences, click on the links given in the description box below this video. In this lesson, we shall learn about the third type of anticonvulsants, that is oxazolidinediones, and the individual drugs such as trimethadione and paramethadione. At the end of this video, you will be able to understand the oxazolidines type of anticonvulsant agents and the specific individual drugs of the class, which include trimethadione and paramethadione. Like other anti-epileptic drugs, the oxazolidinediones were originally developed as hypnotics or analgesics, but they were introduced into anticonvulsant therapy between 1946 and 1948. Oxazolidinedione is chemically an oxazolidine 2,4-dione and is structurally analogous to hypnotoins. The difference is that the NH at position 1 of hypnotoin is replaced by an oxygen atom in oxazolidinediones. 3,5,5-trialkyl oxazolidine 2,4-diones, first tested as hypnotics, showed pronounced anti-epileptic activity. Trimethadione, paramethadione, and allyl methyl oxazolidinedione, that is aloxidone, are the clinically used drugs from this class. They are effective in the treatment of petit-mal seizures, but if used alone, they are ineffective against other types of epilepsy. The most common undesired effects of trimethadione are sedation and hemeralopia, which is blurring of vision in bright light. Paramethadione is reported to have lower incidence of serious side effects as compared to trimethadione. They are considerably more toxic than the succinimide drugs. SAR of oxazolidinediones. The alkyl substituents at position C5 appears to be important for the selectivity of oxazolidinediones. That is, lower alkyl substituents tend towards anti-petit-mal activity, while the aryl substituents towards anti-grand mal activity. Thus, both maledione and dimidione having lower alkyl groups are active against petit-mal epilepsy, while 5,5-diphenyl oxazolidine 2,4-dione having the aryl group is active against grand mal epilepsy. The N-alkyl substituent does not affect the activity since all clinically used agents from this class undergo N-dealkylation in metabolism. That is, the anticonvulsant activity of trimethadione is due to mainly its N-demethylated metabolite dimethadione. Therefore, the N-alkyl substitution does not appear to be necessary for activity. Similarly, paramethadione also undergoes N-demethylation in vivo to yield 5-ethyl 5-methyl oxazolidine 2,4-dione, which is responsible for observed anticonvulsant action of paramethadione. Paramethadione is similar to trimethadione but less effective and less toxic. Trimethadione. Trimethadione is also called as troxidone or tridione. It is an oxazolidinedione anticonvulsant drug, and its IUPAC name is 3,5-trimethyl-1,3-oxazolidine 2,4-dione. It is an oxazolidinedione, that is 1,3-oxazolidine 2,4-dione substituted by methyl groups at position 3, 5 and 5. It is an anti-epileptic agent and is indicated for use in the treatment of absence seizures. The absence of bulky substituents at C5 position exhibit activity against absence seizures. It has a role as an anticonvulsant and a gyroprotector. Trimethadione is synthesized by condensing ethyl 2-hydroxy 2-methyl propionic acid with urea which produces 5,5-dimethyl oxazolidine 2,4-dione. Methylating this product with dimethyl sulfate yields the desired compound trimethadione. Trimethadione occurs as colorless or almost colorless crystals with slightly camphoraceous odor. It has melting point at 40 degrees centigrade and it is insoluble in water. It should be kept in a well-closed container and protected from light. Mechanism of action of trimethadione. Trimethadione reduces T-type calcium currents in the thalamus that increases the threshold for repetitive activities and thus decreases the abnormal thalamocortical rhythmicity which is clinical in absence seizures. It is primarily employed in the treatment of absence or petit-mal seizures but can also be used in refractory temporal lobe epilepsy. It is used only in patients who are refractory to treatment with other medications. It is usually administered 3 or 4 times daily with the total daily dose ranging from 900 mg to 2.4 grams. It is most commonly used to treat epileptic conditions that are resistant to other treatments. Paramethadione. Paramethadione was developed by the Illinois-based pharmaceutical company Abbott Laboratories. It was approved by the FDA in 1949 for the treatment of absence seizures, also called partial seizures. It belongs to the category of oxazolidinedione and its IUPAC name is 5-ethyl 3,5-dimethyl 1,3-oxazolidine 2,4-dione. It differs from trimethadione only in the substitution of one methyl group with an ethyl group. It has a role as an anticonvulsant for the treatment of absence seizures, also called partial seizures. Paramethadione is synthesized by refluxing ethyl 2-hydroxy-2-methyl butyric acid with urea in the presence of sodium methoxide for about 24 hours. During this reaction, the sodium derivative of 5-ethyl 5-methyl 2,4-oxazolidinedione is formed due to condensation and cyclization. This is done upon treatment with dimethyl sulfate. N-methylation takes place to form the product paramethadione. Paramethadione is a clear, colorless liquid and has a fruity ester-like odor. It has melting point at 101.5 degrees centigrade and is slightly soluble in water, freely soluble in alcohol, benzene, chloroform, and ether. When heated to decomposition, it emits toxic fumes of nitrogen oxides. Mechanism of action of paramethadione. Paramethadione acts in a similar mechanism like trimethadione. It acts to reduce T-type calcium currents in thalamic neurons, which has been proposed to underlie the 3 heads spike and wave discharge seen on electroencephalogram, abbreviated EEG, during absence seizures. Paramethadione is sold under the brand name Paradione. It is an anticonvulsant associated with fetal trimethadione syndrome, which is also known as paramethadione syndrome. It is also used in minor forms of epilepsy. This is the list of references followed for the lesson. That's all in this video. The oxazolidinediones, the third type of anticonvulsants, and the individual drugs trimethadione and paramethadione. In the next lesson, we will discuss about the succinimide type of anticonvulsive agents. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.